this tonight. Just let me make a note here on this. So as you know, this is a big initiative in our district, moving for polio, and there'll be an introduction for Mike in a few minutes, but I just want to let you know that many of our members in the district are moving for polio. We'll hear a little more about the stats later on, and also they're donating, which is the whole purpose of this. And I've been making a lot of club visits. I think I'm on number 17 now, and I talk about this at every meeting, and I get quite a bit of enthusiasm, but it's harder to get those numbers in and the donations. So hopefully those that are here tonight, you can see the importance of this initiative and support this and tell your clubs about it, tell your friends about it, because we are looking for sponsors outside of Rotary too. And anyway, it's great to have you here for this important initiative. We'll talk more about our Move for Polio initiative, where we are at the end of the meeting. So I just want to welcome each of you, and it's great to be a part of this group, and I'll turn it back to you, Marlene.
Great, thanks. It's my absolute pleasure to welcome Mike McGovern, who's just home from his weekly club meeting, and he's joined us tonight to provide an update on our commitment to eradicate polio. Mike is an outstanding speaker and an advocate for the eradication of polio. He's passionate, knowledgeable, compassionate, connected, a relationship builder, a fabulous storyteller. He's authentic, and he has an amazing sense of humor. He's real, and he tells it like it is, in the most informative and engaging way. His bio is extensive and impressive, and we could be here all night if I went through it, so I'm just going to give you a really brief snapshot. He served in numerous leadership positions at the club, zone, district, and international level. He's active in his local community and currently serves as the chair of the Rotary International Polio Plus Committee. And he represents Rotary on the Polio Strategy Committee of the Global Polio Eradication Initiative. Mike's a major donor of the Rotary Foundation, and he's a recipient of the Rotary Foundation Citation for Meritorious Service and Distinguished Service Award. Mike is a friend of District 5360. When I messaged him about presenting to us tonight, he was just packing to leave for Geneva. However, without hesitation, he agreed, and here we are tonight. So Mike, I believe it's 8 o'clock in Maine, so we'll turn the program over to you. Thank you.
Thank you, Marlene. Thank you for inviting me. It's 8:05 p.m. in the state of Maine, so we're a couple of hours ahead of you. Good to be with you, Steve. Thank you at all your visits for mentioning polio. That's much appreciated. And I'm not sure that all the other 530 governors do that, but at least there's many who do. So I'm glad you're among those many, and thank you for it. In Marlene's introduction, she mentioned I'm a storyteller, so sometimes I do that, but let me begin with a little bit of a personal story. About 5 weeks ago, I was at something called the Rotary Leadership Institute event in Park Ridge, New Jersey, and they'd asked me to speak, and I was a little unsure what to speak on, but I decided I ought to speak on polio. But anyway, this hotel, it was a Marriott, nice hotel, and it's only 5 minutes from Rockland County, New York. And any of you who follow polio at all, you'd know that Rockland County, in August, or actually, I think it began in June, actually, but didn't get reported till later, reported a case of vaccine-derived polio. It was a 29-year-old male who lives in what I would call a religious community, very anti-vaccine community. And somehow I don't know, they've kept privacy quite a bit, so we don't have all the details on it, but he came down with polio. He was crippled by polio. And this is the first person in the United States or Canada in many, many years who has come down with polio. But he also gave the talk, and it was a good night. There was a woman there who had made a quilt. Bonnie Sarawa, her name is. She passed as for governor from New Jersey. And they auctioned it off, the quilt. And it was a nice quilt, but and it was sort of the theme of the Melbourne Convention. Anyway, after about 15 minutes, they managed to raise $18,000 on this one quilt. And, that's the, I look at it and how Rotary gets this done. Obviously there's a lot of generous Rotarians, but it's the person who stitches the quilt. It's all of the different individuals. But anyway, as I was leaving the ballroom area, and I was out in the lobby of the hotel going back to my room, someone noted that the water in the hotel wasn't running. And I thought, this isn't good. So anyway, I went up to my room, and actually the first thing I did, went to the ice maker, and that was empty, of course. I think they turned it out, stopped it for COVID, but fortunately I had a couple of bottles of water. But anyway, I get up the next morning, and then I tried the faucet. There was no water. So I get up the next morning, and I went into the bathroom, and before I get into the shower, I turned on the faucet at the sink, and lo and behold, all this dirty, gurgling water came out. And I was 5 minutes away from where polio has been found in the environment. And I was thinking, I'm so thankful to my mother that she took me all those years ago in 1957 and 1958 to get my polio vaccines. Because we've always said that polio is only a plane ride away. You pick up polio from drinking dirty water, amongst other things. For me that night, polio was a faucet away. And when Rotarians think we don't need to worry about polio, it's something of the past, that particular case shows that, it can show up anywhere. And, particularly for folks that have low vaccination rates, they can pick up these cases of so-called vaccine-derived polio. And, I know you all received Rotary magazine in your district, and I don't know if you've gotten the October issue yet, but there's a very long, a very good article in it about the vaccine-derived polio. And, if any of you are really, we get a lot of, questions of what is it? And, and I've been saying, watch for the October magazine. Well, it arrived at my house yesterday, I think. So hopefully it's arriving at your homes as well. But it really explains what vaccine-derived polio is. So yeah, so we had this case in New York. We also have had a breakout of these so-called vaccine-derived cases across Central Africa. In every case, it's in communities with this very poor vaccination rates. And what it is that in communities with low vaccination rates, people don't build up immunity to any virus. So they're much more susceptible to different diseases and to viruses that are out there, including polio. So, I remain confident we're going to end polio. And, despite that, really a huge setback. There's been a lot of good positive indicators. Let me start with Afghanistan. I imagine everyone saw on TV last year, everyone trying to escape the airport, and it was a pretty pitiful scene. And immediately, everyone worried, the Taliban was taking over the government, and what was going to happen to polio eradication? How were they going to treat women? What about hiring polio workers? They in the areas that they had controlled before they were the government, but they controlled part of the country, they didn't allow any house-to-house vaccinations. And you really, you got to go house to house to get the polio drops out. Well, anyway, for all of our worry about that, today there's about 9.5 million children in Afghanistan under the age of 5, and our objective is to try to encourage all those kids to be immunized. And at this point, we're not up to totally where we should be, but it ended up that the de facto government, the Taliban, is allowing house-to-house vaccinations in all of the areas of the country that they centrally control. There's a few provinces that it hasn't been happening, but the bottom line is we're immunizing more children in Afghanistan than at any time in history. And we're doing it mostly house to house. They were encouraging something called mosque to mosque. But the problem with mosque is they don't allow women in mosque. And, usually it's the women in the family who take care of the kids' vaccinations and those types of activities. They also, but even in the areas mosque to mosque that doesn't work, we've ended up trying to do something called site to site, which is basically the polio teams show up where outside the grocery stores, that type of thing, where people are apt to be. And particularly, I shouldn't say this, but it's true, in areas where the women are with their children without their husband. Because sometimes it's the man of the house who for whatever reason is more hesitant to allow vaccines. Rick, are you letting in people in the waiting room? I keep saying admit, show up. Okay, good, thank you.
Yeah, I am.
Okay, good. So that's, in fact, I even let someone in on my own at one point. So I hope that it was an okay one. So anyway, so Afghanistan, things are good. Our Rotary chief volunteer there, Mohammed Ishaq Nayazman, regularly meets with the representatives of the government. I had an opportunity actually last November to meet with the new health minister. And he didn't know that much about Rotary, but he committed, total support. They're hiring more and more women vaccinators. And that's all good. In Pakistan, again, those of you that follow polio eradication fairly closely will note that we've had quite a few more cases there this year of the wild polio virus. Last year, worldwide, we only had 6 cases. And I think 4 of them, but we've had, I think it's about 19 cases or so in Pakistan, but I think 3 of them are in one community. That community has 25,000 children under the age of 5. So if we can convince the mothers and fathers in that community to get their kids immunized, we're going to be a long way to finishing off polio in Pakistan. We had a change of government there this past year. They threw out the prime minister who worked very closely with us. The new prime minister has already had 3 meetings of his polio board, his ministers on polio. And the first time I went to Pakistan about 7 years ago, my very first meeting was with the chief minister of Sindh province. Well, it ended up he's now the prime minister. So you never know who you meet with, who they're going to do, what job they're going to end up in. So Pakistan, if we can, we call them consequential geographies. If we can focus on the consequential geographies, there's no reason to think that we can't get polio done. There aren't any vaccine-derived cases in Pakistan, and we'd actually gone 14 months without a case. And, suddenly they began to crop up in this one community. And it was, again, huge resistance in that community to vaccinations. There was talk the last 2 weeks of maybe having the Army go in and do the vaccinations. And fortunately, the Army said no. The Army has a mixed reputation in that area. They had gone in there and cleaned out some bad guys a couple of years ago. We've never forced anyone to take a vaccination, the polio program. It's despite how close we are, I still don't think it's the time to start. And actually, I was at a meeting at UNICEF in New York last week. I was at another meeting in New York, and then the UNICEF people invited me to come in and talk to them, and they had updated me on this, and they agree, they were in total agreement that the way to get this done is to convince people of the need to get polio drops. Beyond that, we also had some polio cases in Malawi late last year, and those spread over to Mozambique. It's all on the Zambezi River. If any of you have ever been to Victoria Falls, that's the Zambezi River, but this is the other end of it. And again, that came from Lahore, Pakistan. It was another one of those cases that we know where it came from. They do lab testing of from the person, and as a result, they know whether or not they know exactly where the virus came from. So that was from Pakistan, which again convinces me that we need to really focus on Pakistan and Afghanistan in order to stop the original source of all these. But the governments in those areas, with the exception of Zimbabwe, the Malawi, Mozambique, and the others have responded very quickly. We've also, and particularly we've continued to have some of these vaccine-derived cases. A positive development is a little over a year ago, there was a new oral polio vaccine that was developed exactly to stop these vaccine-derived cases. It's a more stable vaccine, and it was believed when it was developed, the whole intent was to have it so that it couldn't mutate and help spread polio to those unvaccinated from those who were vaccinated. As of next month, it'll be announced that 500 million doses of this vaccine have been delivered. It's a tremendous rollout. When I was at a recent meeting, I asked the WHO polio director how he would grade this new vaccine. And he said, the old vaccine they've been using, the bivalent vaccine, he would give it C2 in terms of its overall effectiveness. But this new vaccine, he gave a B+, which is good. And I heard a presentation from the scientists at the University of Antwerp, Belgium. Some European Rotarians had him as a guest last week. And, just fascinating to see how the continued investment in research that Rotary helps to fund can be making such a difference and give us the renewed optimism that we're near to the end of ending polio. So it's good to see that. When we initially had it, we had some supply problems. It's only made at one factory in Indonesia. At this point, our supplies are good through the first 2 quarters of next year, a little shaky after that. But we also have India that's looking at opening their own plant, not only for their own use within India, but also to spread it around the world. So, we remain optimistic. The cases are a little bit higher than we'd like. We seem to be getting out in front of these vaccine-derived cases now. And everywhere where we've seen polio cases, with the exception of Zimbabwe, which, it happens, but where they actually haven't had a case, it's positive. The London situation you may have heard of, that was positive environmental samples. We haven't actually seen anyone come down with polio. We also had some vaccine-derived cases in Jerusalem. And it's interesting that Jerusalem, the New York, and the London cases were all traceable back to Pakistan. So we know where they're coming from, and we know where we focus. Rotary fundraising has been a bit of a challenge this last year. As a lot of people devoted a lot of resources to helping out with the Ukrainian evacuation. That, very positive, very good to see that. But it definitely dented some of the contribution that otherwise might have gone to polio. Similarly, last year, the trustees of the Rotary Foundation reduced in half the match of something called district designated funds. And went from a 1-to-1 match to a 50 cents on the dollar match. It wasn't the best messaging, first of all, but secondly, they did it because they'd had such demand for global grants, and they wanted to address those, and I understand that. But what ended up happening is the Rotary Foundation last year, even with all the Ukraine grants, did not have as many global grants as they expected. Part of that was so many clubs did things with Ukraine. And they had tremendous savings on travel and some of the other expenses of the Rotary Foundation. So the global fundraising for polio, the goal every year is to raise $50 million. And then that's matched 2-to-1 by the Bill and Melinda Gates Foundation. The reality, as it ended up, we think all the final numbers are in, but anyway, it ended up $43 million. And, that when people hear that, they become greatly concerned. Well, we're losing that 7 million, we're losing 14 million on the Gates match. Well, as I mentioned, the trustees had a lot of savings, and they voted at their their meeting following the Houston convention, that up to a certain level, they would make up the difference. Well, they did that. So, it's, I'll be meeting with the trustees in a couple of weeks, and I will be profoundly thanking them for doing that. The International Polio Plus Committee is meeting next week. We'll be looking at grants of $50 million, primarily focused on Pakistan, Afghanistan, providing vaccine and working in these outbreak countries, particularly in Africa. And we're able to allocate $50 million because of the $43 million that Rotarians donated, the $7 million that the trustees supplemented it. And as soon as we notify the Gates Foundation that we've sent that $50 million to WHO and UNICEF, the Gates Foundation will wire us $100 million, thus the 2-for-1 match. This will make $1,385 million that the Gates Foundation has entrusted Rotary to spend to eradicate polio. Rotarians themselves now have given about $1.2 billion through individual contributions, money we've raised in the community, as well as through the district designated funds. So it's it's troublesome. Jennifer Jones, our president, who a lot of fellow Canadian, announced that Rotary made a pledge of $150 million over the next 3 years. Obviously, we're going to have to do better than the $43 million in order to meet that pledge. And but we need to update our messaging. We're looking at, we're still going to use End Polio Now, but you might see some colors other than this red. And we're also going to be dusting off and improving the graphics of the message Together We End Polio. And that's really how it works. It's all of us who are on this call, the Rotarians around the world, as well as those we ask to support us, the governments of the world, the frontline workers, the government of Pakistan, and all these others. We got to work together to get this done. And I know your district's been particularly focused on helping with polio. That's appreciated. And even my own club today, they announced they're doing something called Pints for Polio. They're meeting in the middle of some bridge on October 20th to have photos taken for the press, all those things. And then some member was so impressed hearing the things that did, he handed me a crisp $100 bill, which I immediately gave to our foundation chair in the club. So, it's all those individual actions. Together we end polio. So, Marlene, I'd be happy to answer any questions. I've covered quite a bit, but I'm sure there's things I've missed.
Perfect. So Rick, how would you like to do that? Do you want people to raise their hands or put them in the chat?
Well, yeah, there's been some in the chat, but no questions, just a link. And I would recommend that if anybody has a question, put their hand up, and then we'll acknowledge them, and they can deal directly with Mike on the.
Yeah, no, I've got my screen set up that I can actually see everyone who's visible. And for those that have what I would call black screens, if you just go, into a live screen or unmute yourself, you don't need to show yourself necessarily. Be happy to answer any questions from anyone.
Yeah, don't be shy.
No.
Mike, I'll maybe
Liz Audenhart, I see you were on the call. Wonderful to have you with us today. That's great. It's funny how you suddenly notice names on the screen. That's great.
Okay, I see Christine's hands up first, so let's start with her.
Thanks, Rick. Hi, Mike. What would you say is the biggest barrier right now for us? Is it the funding? Is it political unrest? Those kind of things. What would you say is the biggest barrier that the Rotary has?
I'm answering this question based on the partnership and not just Rotary. But there is so much competition for money right now for dealing with measles and malaria, AIDS, all those different things. The government of the United Kingdom has drastically cut back on their funding. Canada is where they haven't made a definite commitment. We expect that they will be generous, but that makes sense. But I think it's money. And it's, we really need to maintain our focus on these, what I refer to as consequential geographies. We've had a lot of cases of the vaccine drive polio, for example, in Yemen. And Yemen's in the middle of a war at this point. And that's basically where we end up having problems. So it's, and then there's some fatigue out there. And I don't mean just raising money, but, if you keep showing up at the doors over and over and with polio vaccines, the folks want something else. They want more. And, we need to work a lot more closely with, those that provide other vaccines and interventions to help. I'm not suggesting we take over all vaccines as Rotary, but, while we're delivering the polio vaccines, we need to invite, there's no additional cost to the folks providing other vaccines to Rotary. We're not paying for those other vaccines, but at the same time, we need to do more integration with other things. It's winning the hearts and minds of folks. Jorita Solari, who is from California, she just went to Pakistan last week, and she and her husband ended up donating monies to fund a solar water infiltration plant so that people have clean water. She visited the dedication of one that was done by grants of Rotary clubs, and she was so impressed that she and Bruce decided to donate the funds to do another one. And it's actions like that one, they're inspirational, but two, we need to win the hearts of the folks in the area. So, Anthony?
I was a little surprised that the previous vaccine only got a C and the new one's only getting a B+. I can understand in some respects that the C may be because it did cause some people to get polio, but why only a B+ for the new vaccine?
Why only a B+? We've had a few breakout cases, first of all. Not major, but we still have had a few in areas where it's being almost exclusively utilized. I think the second thing is supply issues. But and no vaccine is perfect. Everyone's system's different. We know from getting our COVID vaccines, people that have are immunocompromised in different ways. Vaccines aren't as effective, and that it's the same with the polio vaccine. But yeah, to be honest with you, I was a little surprised too, Anthony, that he didn't give it an A. But he's an Irishman. Aidan O'Leary, his name is, and maybe he's just not big at giving out the highest grade. Maybe he's leaving himself a little room and stuff in case something goes wrong. But who knows? But generally, it was, the report that we got at the meeting we were at was very, very positive, as well as the the update I heard in the Europe Synergy Group, or whatever it is called, some Rotarians in Europe that meet once a month, and hearing the professor who developed the vaccine, he actually was very pleased. He hadn't heard the latest numbers of how much it's out there, but all of the testing that he's seen has been very positive. Rick and Governor Steve.
Yeah, go ahead, Steve.
Oh, thanks, Rick. So Mike, first of all, thanks so much for that update. It answers a lot of questions that I get at some of these club meetings. So my question would be, is there going to be things, say in New York and other areas where these cases have come up for education and helping convince these people that don't want the polio vaccine to get it? Is there anything in the works for that?
That's another good question. Not to the level that we'd like. Immediately we heard about the New York cases. We called Drew Kessler. I contacted him. He actually is from Rockland County, and he is the director now who represents all of most of Canada, not all of it, in the Northeast United States. And your counterpart in that area, the district governor, approached the health officials in the county, and they weren't, it's a reaction we see. We saw it with COVID in my own state. We do this, we don't need your help. Those weren't their exact words, but they weren't exactly welcoming of help. And because I was talking yesterday to John Sever, who was the district governor who first proposed that we do polio back in the 1980s. And he asked me that same question. And, he was very disappointed to hear that Rotarians aren't more engaged. I was on a call with Rochelle Walensky last week. She's the head of the United States Centers for Disease Control. And she indicated that the CDC in the United States is really ramping up their efforts to promote vaccination in low vaccination communities. We know where they are. They tend to be well-to-do communities on the coast of California, those types of places. And then there's pockets of anti-vax communities of, but they say they're based on religion, but I don't understand that. But more work needs to be done. And we in the United States and Canada, the polio, we don't drop, it isn't drops, it's the injectable polio vaccine that's given. So I'm gonna talk again to the district governor in that area of New York. 7410 I think is the district. I could be a little off. And really encourage them to renew their attempts. But the other issue, when you look at Rotary membership, it's a very Orthodox Jewish community where that's anti-vax. And for whatever reason, there aren't many from that community who are in Rotary. And it just begs the issue that Rotary to be successful needs to look like the communities where they're in. And it's a weakness for us in a lot of places, is that we don't have the diversity, the equity, the diversity and the inclusion that we need to have. So it's a work in progress, Steve, but we definitely, there's a role for Rotarians. And I asked them simply to go and meet with the health officials and tell them what Rotary's done in other places. And it was rebuffed.
Mike, I believe we're told that the younger people, the young generation, are interested in joining or supporting causes that are relevant, important, and perhaps even timely to them. And of course, the younger generation doesn't really know much about polio because they really haven't been in a world that's been like a pandemic with it. I mean, COVID is probably the thing that's biggest on their mind. How is the foundation or the End Polio campaign going to try to bring these people into either fundraising or like supporting it with money, or I don't know, I think they're still doing NID things. I'm just wondering how the message will need to change to attract the younger generation to something that's really not relevant to them today.
One example is Jennifer Jones, our president, attended the Global Citizen Festival over the weekend in New York and spoke to 60,000 young people at a concert specifically about Rotary and what we're doing with polio. I've found that there's some in the United States with the Rotaractors, and we try to engage with the place of Rotaractors, but Rotaract isn't all that strong in the United States anyway. But in other places of the world, you go to the Philippines, for instance, the younger Rotarians are completely invested in spending time and doing other things in eradicating polio. The Rotarians in Pakistan of all ages, I've been there a few times, and they show up at the events with their kids, and their kids have on the End Polio Now t-shirts, and they enjoy marching in the parades. There is some engagement, and I agree with your central premise that young people are interested in causes. And I mentioned my own club is, some of the younger members are doing pints for polio. They're going to something called the Four River Brewery, and they're having beers. And the place has agreed to donate, I don't know how much. I think last year they raised $2,000 from just going and drinking beer and getting the other customers to donate. So I think that's how we engage in them. But I admit it's tough. It's when most of us on this call knew people who had polio of our generation, of older family members. My case, it was a distant cousin. And, people under a certain age don't do that. The other real problem is that the media, most of the working press these days, they're pretty young. They're doing blogs and all the other things they do, and they don't have a clue about polio. I saw a thing done the other day. It was a blog or whatever it was, and the guy sort of made fun of Rotary working on polio. It was a little disheartening, and then the response was given, and the person who answered it turned around. I actually did my first podcast today. I'd never done a podcast, and I have no idea what it was or who it was. The host was a woman that was on HGTV, co-host of a program, and it's things like that, reaching audiences that we otherwise don't usually reach. So, Marlene.
Yeah, sorry, Rick and I were on the same wavelength, because July 1st, we walked in a parade down in Raymond, and we had our polio shirts and everything. And I remember walking by a young man and yelled out, "What's polio?" And then recently, Bill Quinney's on the call. Their club did an amazing race, and they had a station where there was a polio survivor that told his story. There was some history about polio, and we had the iron lung there. And one of the challenges was you had to spend time in the iron lung. And these young people were blown away. They had no idea. They were really moved by the polio survivor's story. They couldn't get over the lung. They just thought it was the most amazing contraption they'd ever seen. So yeah, I guess for me, it's this younger, as we say, they have never experienced or don't know somebody. So just somehow that education to them.
I think your point is for them to relate to things, they want to have hands-on experiences. And, it's difficult to do it in my country and in your country with polio, because, it's the whole way polio is delivered is different than what we have in Pakistan and in most of Africa. It's a challenge. Dan, but it's good to hear that you had that event. That's great.
Yeah, I think, to your point about Rotaract and younger Rotarians, I know that the work that we did in Ethiopia on our NID could not have been accomplished without the Rotaractors. The Rotarians actually sat back in the hotel while the Rotaractors came with us and did the heavy lifting and moving the polio around. So I think that there's, in the world of Rotary, it's a little bit different in Africa and Asia and some of these other countries. My one question I do have, though, is the impact that those NIDs can have not only on the communities, but also on the Rotarians that participate. I know that's what made Marlene a Rotarian and join. And I know that over the past few years, because of the violence and some of the other issues, we've backed off on the polio NIDs with Rotarians. What's the strategy, or is there anything like that moving forward?
Yeah, the main reason for drop off was COVID. We just weren't, the people who organize NIDs, they're all done independently by Rotarians, just were not organizing them. I'm beginning to hear from some of the individuals who organize them that that's a possibility. I imagine Ethiopia was I can't think of it.
Ezra to show me.
That's about what was to come out, but he's led quite a few to Ethiopia, but Ethiopia is troublesome now with, there's political issues there. So, I'm not sure, visiting there, how that works, but, Pakistan in a limited way, has some folks come. India still has NIDs. Nigeria is still welcoming of them. And, I know 3 or 4 Rotarians who are beginning to think again of organizing groups for NIDs. We'll see. It's, they're independently run, but what I do know is the Rotarians in the places where they're done are very welcoming, and would love to see Rotarians come participating in NIDs and helping to support the effort.
Any other questions, folks? Maybe another one just come to mind, Mike. You mentioned there's a link between where we're getting some of these flare-ups related to war or conflict or different things like that. I don't want you to speculate, but is there been any discussion about what's happening in Ukraine as to how that might impact a polio outbreak in that country?
You know, that's a, you know, we had 2 vaccine derived cases in Ukraine in 2021, early in the year. We were very worried when all those refugees left the country, that perhaps there was some circulation there we didn't know about. We have seen absolutely nothing come out of the situation in Ukraine in terms of polio cases of any type anywhere in the world. So that's a positive sign. We do worry that, you know, Ukraine really hasn't been focusing a whole lot on vaccinations of late. You know, that they've had a lot of other challenges, and we worry about that. So, you know, wherever there's political disturbances, military actions, it always is challenging. You know, 3 years ago, we were also very worried about Syria. You know, Syria was very much in the news, and ISIS there. It ended up, even during the worst of that, the WHO, UNICEF was able to go into the country and work in the toughest areas to provide the vaccines that were necessary. And Syria's been very quiet since. So it's, you know, that's, I can't say enough about UNICEF and the work they do to you know, broker agreements that vaccinations can occur. It's very good, positive work. Rhea?
Yeah, going back to the comment about the role of the Rotaractor, just some current update, because I'm a mentor and have mentees at the University of Calgary. And last year we had about 58 members of Rotaract because of the COVID. This year we have 200, and there's an introductory program tomorrow night for anybody else that's interested. But what I'm finding is a lot of these young people are in studies around bioscience. And I think that probably if there was an opportunity to create something around the bacillus and get these young people to promote it as part of a science thing, that might be an opportunity to really make more people aware of polio.
Great idea, Rhea. You know, it's interesting, particularly in the public health schools, you know, around Canada and the United States. You know, the focus has tended to be on HIV and you know, Ebola, and now COVID. But you know, I think, you know, we ought to try to work with some of the public health schools around our 2 countries and see what we can do to better engage some of them, and, you know, particularly to you know, we can work with WHO, the Gates Foundation, and UNICEF, and the CDC has a program called the STOP program that's funded that could help. You know, some of these public health students could get practical experience in some of the areas we're working on polio. So, Rhea, I'll follow up on that.
Thank you.
You're muted, Rick.
Number 1 statement in Zoom world today. You are muted. And the second one is next slide, please.
Yeah.
We had a couple of people come in a little bit later. If they would like to table a question, just raise your hand and show yourself. And Mike's been very good at answering questions all evening here. So. If not, I guess Marlene will, turn it over to Dan for some wrap up.
Oh, you know, Mike, this is the easiest thank you you can do. I mean, the reason that we love having you give us the updates is that we get the real world situation, and it's we're not guessing about the statistics, we're not guessing about the programs and how we're moving, and as well as what the challenges are. And I think that you've articulated so well where we're at, and the real reasons that we need to continue this fight and continue to end this terrible disease. And I think we're going to do it, and we will do it with the leadership of people like you. And I don't know how to thank you more, other than to say that Marlene and I have made a donation in your name in Polio Plus to move to keep the movement moving forward. So again, thank you for your leadership. Thank you for your openness with us, and actually thank you so much for the motivation to keep the fight going. Thank you.
Thank you, Dan. Thank you, Marlene, and thank you all for all you do.
Thanks, Mike. And I know now you're coming up to
9 o'clock.
9 o'clock.
So Marlene, there's a couple of people that had questions. Bev had a question, Hank had a question. Can we do that?
No,
or-
I was just using the clap one.
Oh, gotcha.
I was only clapping as well, Rick.
Okay.
all righty. Thanks again, Mike. We really, really appreciate all you do and your leadership. So the next we'll just take a few minutes. We just wanted to give you a quick update at where we're at. And I'm going to be the bad news and Steve gets to be the good news. So we do have a goal of 100,000 kilometers and $100,000. We've got about a month to go, but we are behind. We're behind our numbers. Our kilometers are pretty good. We're about halfway there. But last year we had 30 club champions and this year we have 13. So it's not too late to join. We are happy to grandfather your kilometers and happy to accept your donations. We're currently sitting at about 11,000 US, 3,325 from Race for Rotary and about 68,000 from Polio Plus. So we really did try to simplify things this year with the tracking and the reporting. So each club champion was sent a link so that they could just share that with their members. And every 2 weeks on the weekly digest, Charlene does have an update and a direct link where you can go in and update. And she also has the direct link to Race for Rotary. And I know Dan has put that in the chat, but we will make an effort to circulate those two things so that the reporting and the tracking and the donating can be as simple as possible.
The link didn't work when we did it. It came up with error 404. So
okay, I'll get a hold of Charlene and we will get that sorted out. I am very grateful for a number of clubs who have organized events. There was some mini golf in Okotoks. There was a walk in Turner Valley. I know there's a bowling competition coming up, Pins for Polio. So like Mike said, be creative. If your club would like to sponsor something or if you would like to challenge another Rotary club in a friendly competition, all of those things add up and they make a big difference, not only for the fellowship, but it moves people to maybe hand over those crisp $100 bills. So we will continue with our emails and we'll continue to try and promote through the weekly digest. But if you're participating in something for polio, please, we know that the social media is really a great way to go. So that's my 2 cents. How about you, Steve?
Thank you, Marlene, and thanks so much, Mike, to take the time to be with us and give us all those answers to our questions. I would just like to kind of summarize by saying that, you know, it's been a great initiative. I was involved last year. We seem to, as Marlene said, have a higher uptake. I just wanted to share an experience I had with Susan. She's the club president in Red Deer Sunrise, and she said they were involved last year, but they don't have a champion this year. And so I told her I had a goal to meet the year 2,022 kilometers on my bike, and right now I'm about 1,500, so I'm on track, but that darn Martin Purnell's ahead of me. our past district governor. And then she says, you know what? If I go back to July, I'm going to beat you. And so we got to get some competition going amongst our clubs, among the members. And Canmore is leading the charge now. I think they're 12,000 and something. Cochrane's around 8. And little old Raymond with 12 members, we're third at 6,000 and some. So we got to get this competition going amongst the clubs, not only for the kilometers, but for the money. And it was interesting, Mike, that you mentioned it's a little harder to get money because Rotarians are donating to Ukrainian help. And I imagine we'll be hearing things about how we can help our fellow Rotarians in Eastern Canada. So that will probably be another thing that we'll be trying to get money for. But I know if each of you that are here, go back to your clubs, you be a champion if you don't have one already. Let's get involved. Let Marlene know if you want your club to be included. And I think Marlene, if that link's readily available on our website and emails each week or whatever, we can get more people donating. So I just appreciate those that have done so far in both moving and in the dollars. And we just got to keep the ball rolling. We got a little over a month here.
Great. Once again, Mike, thank you so much. And Steve, thank you for your commitment. I know that you do promote the Move for Polio with all your clubs, and that's really, really impressive. Rick, I want to thank you for hosting tonight. We really appreciate you. And it was great to have Dan and Velma here. Dan and Velma and Dwayne are part of the mental health component of Move for Polio. So we're pleased to have them. And I want to give a shout out to Vic. Vic is the brainchild behind this whole initiative. Started 2 years ago. So Vic, we are so grateful for you, and we know that you are a true polio warrior. Rick has recorded this, and so Rick, how will people access the recording so they can share it with other club members?
Well, everybody tonight, we'll upload it probably within the next day to our district YouTube channel. We'll send everybody here that, in fact, I'll send it to everybody that registered tonight. We had 35 in total register, and of course we only had 21, participate tonight, but everybody that register will get the link. And if you like, we can put it in the event digest for next week, and then everybody in the district that gets it would have that as well. So that's what I would suggest.
Perfect. That sounds great. Well, I can hardly wait to go to my mailbox tomorrow and see if I have my October issue. Steve?
One more comment. I just made a note here, but if we rely on just Rotarians, it's going to be a harder battle to get the numbers, but I intend to send a note out to my friends and family asking them to donate to what I'm doing. I'm just wondering, would that be advantageous if we had kind of a form letter, go to every member of the district, say just copy and paste this, it's got the link on it, and let's get some donations from outside? Do you think that would be advantageous?
Sure. Sounds like a great idea. We can
Okay,
connect
well,
with that one.
What if we, a lot of the clubs have some partnership or collaboration with other non-Rotary organizations. Why don't we approach them, ones that we've been working with? Even I'll just use an example, the Calgary Food Bank. Send it to the Calgary Food Bank staff, and because we're, a lot of our Rotary clubs support the Calgary Food Bank and other organizations like that. Maybe they got giving hearts in somewhere in that organization, because I do agree with what Steve has said. It's we're putting a cap on it by just focusing on the Rotarians. We got to get more donations coming in through the public as best we can. Maybe a starting point.
Good idea.
Great. Good. Well, any ideas, please don't hesitate to contact Steve or I. We're happy to assist in any way we can. All right. Well, thanks, everyone. Enjoy the rest of your evening, and we will get to that finish line. Thanks so much.
Thanks, Marlene.
Thank you.
Thanks, Marlene.
Thanks.
Thank you, everyone.
Thanks, Mike. Thanks, Rick. Good night.
Night.
Thanks, Steve. Good night.
Night.